To submit clinical forms and reports for your patient and manage their participation in the screening programs, click on Choose a Form. Submitting clinical information for your patients is crucial. Accurate and timely submissions helps ensure your patients are assigned to the correct screening pathways and receive the appropriate invitations and follow-up from the program. Without this information, there may be delays in care, and our follow-up team may need to contact you if your patient has a high-risk result. You can select to view forms and reports for either program. If they are only participating in one program, only those reports and forms will display. The following forms and reports are available for the National Cervical Screening Program. Please note that some forms may not display, depending on the patient screening pathway. This list represents all available forms, not necessarily those for the test patient in this demonstration. Colposcopy Referral Notification. Use this form to notify the NCSR of colposcopy details or alternative management for a patient with a high-risk cervical screening test result. This ensures that your patient is appropriately monitored and managed. The form is also used to advise the NCSR of future colposcopy referral details and dates. Colposcopy and Treatment Form. To be completed by a colposcopist to inform the participant's clinical pathway, supporting the NCSR safety net functioning by ensuring that high-risk patients are followed up appropriately. Add total hysterectomy. Notifies the NCSR when a patient has had a total hysterectomy. Once the notification is submitted, a total hysterectomy alert will be set against the patient's record. You can also submit the following forms to manage your patient's participation in the surgical program. Defer surgical program. To change the date of your patient's next screening, perhaps because of travel or other reasons. Opt-out surgical program. This will end your patient's participation in the surgical program. Your patient can still book in a surgical screening test with a healthcare provider, but results won't be recorded in the NCSR, and they won't be sent reminders to screen. They can resume participation at any time via the participant portal, calling the NCSR, or at the request of their healthcare provider. Cervical Program Correspondence Preference for you. Provides the option for your patient to receive postal correspondence or cease all surgical program correspondence. To find out more about the National Cervical Screening Program, visit health.gov.au/NCSP.